The Chapter 1 and Chapter 2 are included in the test, and the Chapter 1 is pharmacokinetics, and the key questions are the routes of drug administration, so the enteral routes including oral and sublingual, and then the parenteral routes, intramuscular, intravenous, and subcutaneous, and then other routes like inhalation, nasal, topical, transdermal, and rectal. So the second question is absorption of drugs and mechanism of absorption, including passive diffusion, facilitated diffusion, active transport, transport, and endocytosis. Then the next question is factors influencing absorption, effect of the pH, blood flow, and total surface area of absorption, as well as the P-glycoprotein expression. Then next question is bioavailability, how to determine bioavailability, and the factors that influence the bioavailability, including the first pass hepatic metabolism, solubility of the drug, chemical instability, and the nature of the drug formulation. Then also, what is the bioequivalence and what is the therapeutic equivalence? The next question is drug distribution and the blood flow and permeability of the vessels, and also the binding of the drug to plasma proteins and tissues. Then the next question is lipophilicity and the volume of distribution and the distribution of the water compartments in the body, including the plasma compartment, extracellular, and an intracellular compartment. Then what is the apparent volume of distribution and the determination of the volume of distribution and the effect of the volume on drug half-life. The next question is the drug clearance through the metabolism, the kinetics of the metabolism, zero-order kinetics, and the reactions of drug metabolism, phase 1 and phase 2. So the next question is the phase 1 reactions, including the specificity, genetic variability, inducers, and inhibitors, and also phase 2 reactions. Next question is drug clearance by the kidney, the glomerular filtration and proximal tubular secretion, and reabsorption in the distal tumula. And the last question, I think, for pharmacokinetics is clearance by other routes, including the total body clearance, and then also the design and optimization of dosage regime. That it is in the next question. That includes the continuous infusion and then the fixed dose regimes. Maintenance dose and loading dose for optimization and dose adjustment. So, and this is from the first questions from the first paragraph, and then questions from the second paragraph include the signal transduction, the drug receptor complex, and receptor families. So the 4 receptor families, including the line-gated ion channels, G-protein-coupled receptors, enzyme-linked receptors, and intracellular receptors. So then the next question is the characteristic of the signal transduction, like signal amplification and desensitization and down regulation of receptors. Next question, dose-response relationships, grade dose-response relations, potency and efficacy. Next question, effect of drug concentration on receptor binding and a relationship of drug binding to pharmacologic effect. Next question is intrinsic activity, full and partial agonists and inverse agonists. Our next question is antagonists, competitive, irreversible, and allosteric antagonists, and functional antagonists. Next question, and the final I think, is therapeutic index and clinical usefulness of that index. So that is all that you need to know about the uh, test 1. So this is test 1.